nonprofit called Tri-Town 55 Plus.
Terrific, thank you. What we're going to be doing today is going through a very short slide deck together and then opening it up for some questions and discussion for all the folks that are in the room. If you have not already muted yourself, if you could please do so that we're able to hear the presentation and the slides, and we'll move through this quickly so we can have some discussion together. Next slide, please. Thank you. So, I'm Karen Alexander, as I said, from NJTIP at Rutgers. We are part of the Voorhees Transportation Center at Rutgers University within the Blaustein School of Planning and Public Policy. NJTIP stands for the New Jersey Travel Independence Program. That's what the acronym is. And we work to increase the independence and self-sufficiency of people with disabilities, older adults and others, by empowering them to use the public transit system safely and independently. So in some ways, over the last 6 months, we have been in the crosshairs of being at a higher education institution and dedicated to helping people use public transportation. It's been an interesting time. To date, we have trained over 12,000 people over the last decade to use public transportation in group settings, and over 450 people who are Access Link eligible who have been trained to use the transit system by NJTIP through our partnership with Access Link and New Jersey Transit. Next slide, please. So part of the reason we're here today is we know there's going to be exponential, explosive growth of older adults in New Jersey and around the country. And just to remind ourselves, by 2034, 2.5 million people in the state of New Jersey are projected to be over the age of 60. And the 75 plus population is going to increase by 61%. The under 60 population is only going to grow about 2% in that same period. So the demographics that we see in New Jersey looking ahead is going to have a much higher concentration of older adults than ever seen in its history. Next slide, please. This change in population is going to have a significant impact on the mobility of older adults. 21% of people over the age of 65 don't drive. We know there's going to be a large increase in the 65 plus population. Across the country, it'll be 20% of the population by 2030. Almost half of non-drivers over the age of 65 stay home on any given day, and older women take fewer trips than older men. People who retire from driving at age 70 spend 6 to 10 years dependent on others for their transportation needs, and we know that driving cessation is correlated with less independence and greater social isolation. All of these are statistics that I've been saying for a long time related to senior mobility. I think what's changed in this moment is that since March 2020, people of all ages have been less mobile, and they have been isolated with social distancing and stay-at-home orders. One of the concepts somebody once shared with me about older adults and senior mobility was the idea of faceless days, the day an older adult didn't see another face. I think in the last 6 months, many of us have now experienced faceless days, people of all ages, because of COVID-19. And I think it makes the progress forward different because there's been this collective experience of distancing and social isolation. Next slide, please. However, this is a moment in history, and we will go forward from this moment into whatever comes next. And what I'd like to highlight for you briefly today are 4 interesting best practices that transit systems in different parts of the country have introduced specifically to welcome older adults to their system and encourage older adult ridership. I'm a big believer in mottos and slogans. For LA Metro, I'd say an educated consumer is our best customer. For Flint MTA, if you can't get there, it doesn't exist for you. For SMART, which is the Detroit area transit system, it would be nice to have a place to sit. And for Philadelphia, what's better than free? Next slide, please. So in Los Angeles, they have created a program called On the Move Riders Club. And the On the Move Riders Club helps connect older adults to each other and foster new friendships by encouraging seniors to learn how to take a ride and take a test trip on the transit system. Some of you may know that over the last 20 years, Los Angeles has really built out its light rail system, recovering what were the old red car lines in the 30s and 40s and 50s, and sort of rebuilding that infrastructure. They have senior citizen travel clubs that meet at senior centers. 37 different centers have these volunteer travel clubs, and together they plan destinations that include sightseeing, cultural events, and just fun activities. They do both group trips, and then trained volunteers do individual coaching for folks that want a little bit more help one-on-one. The program is very popular and is actually integrated into the transit system in Los Angeles through their customer outreach and customer information function, as opposed to a disability-oriented function. It's part of their overall marketing effort. Next slide, please. In Flint, which is a suburban area just outside of Detroit, but definitely a motor city kind of place, they have created a senior shopper service, specifically going from senior citizen residences to specific grocery and shopping areas that runs in concert with the regular fixed route system. So if you're an older adult that's living in one of these communities, you know that, for example, on Monday at 9:15, you can pick up a bus that's going to take you to the Meisner Burton store. This runs 5 days a week, and they actually use electric vehicles that are very low impact in terms of the environment, which the seniors think is great, but are also low impact in terms of they have very good shock absorbing systems. So they're comfortable for older adults to ride in these smaller vehicles. Next slide, please. So the SMART system, which is in Detroit, is the one that I said it'd be nice to have a place to sit. The way that they encourage places to sit in the suburban Detroit area is by having local businesses adopt bus stops so that they maintain them, clear the snow from them, keep the trash from them, and they're able to actually advertise their business on those bus stops. This allows for protection from the weather, which in Detroit would mean a lot of snow, and also seating, so that everyone who uses those bus stops are more comfortable. When you look at surveys about what makes public transportation systems more comfortable for older adults, protection from weather and a place to sit always come up high on those surveys. Next slide, please. So what's better than free? If you live in Pennsylvania and you're over the age of 65, you get free public transportation. So don't everybody rush across the river, but this is a real attractive and positive aspect of aging in Pennsylvania. One of the other things that's happened with their free transit for people over the age of 65 is very close integration with the Division on Aging at the state level to market and promote this information. And if you go to the aging website in Pennsylvania, you'll see links to all of the transit systems across the state, because it ties back to this idea of making sure this benefit is widely available. Next slide, please. So here in New Jersey, we have lots of options that are actually senior friendly. We have New Jersey Transit Fixed Route Service, paratransit, town municipal dial-a-ride services, we have nonprofit organizations, we have Medicaid and medical vans, and increasingly we're seeing taxis, livery, Uber, and the major medical organizations many of them have started either Uber or Lyft or bus transportation, taxi transportation programs. Transportation management associations are nonprofits that help disseminate information about transportation all over the state. Every county has a TMA. And this picture is actually 3 ladies from Westwood who came with us on a group trip on the New Jersey Transit train with NJTIP. So all of these are ways that older adults can potentially already move around within New Jersey. Next slide, please. Of course, in the last 6 months, moving around has been confined or constrained to necessary travel, essential travel. And we're beginning at NJTIP to train people on how to make those essential trips by wearing a mask, traveling during uncrowded times, using contactless payment, cleaning your hands as soon as possible, and considering other forms of transportation if necessary. We have been offering remote and virtual training and field trips through the pandemic. We are now beginning to offer in-field training for essential trips in conjunction with New Jersey Transit, CDC guidelines, and Rutgers University policy. Next slide, please. In short, what we're coming to find at this moment is it's always been true if you had a choice of lots of modes, you had the opportunity for more independence. What we're seeing over these last 6 months is older adults connecting virtually to get the things they need, so that rather than looking solely at mobility, we're increasingly looking at access. Not how do I get to it, but how does it get to me? We're seeing specialized transportation retooling their resources, and we're going to hear more about that from subsequent speakers in terms of efforts in New Jersey to make sure people are connected to the things they need. And we're seeing mobility on demand evolve as well during this time. But it really boils down to making sure that older adults have access to safe and reliable and senior-friendly transportation. Next slide, please. To help us get there, there's currently a study underway, understanding the mobility needs for an aging New Jersey population. It's going to be identifying areas of growth in population over the next 20 years, looking at existing services, as well as some of the best practices across the country to see which of those practices could potentially benefit application or adaptation in New Jersey. The good news for those of you who are on the call today is there's currently a survey open to people over the age of 55. And at the end of today's session, we'll provide you with information on how you can get the link to that survey and disseminate it to other people. It's open through the end of the week. We have over 3,000 responses so far. Next slide, please. With that, I'm going to turn it over to Janelle Rivera to talk to you about New Jersey Transit and community transportation. Janelle?
Hi, thank you, Karen. As I said earlier, my name is Janelle Rivera. I'm the manager of local programs at New Jersey Transit. My department administers state and federal funding sources that support programs for seniors, people with disability, people of low income, and individuals that live in rural areas in the state of New Jersey. Next slide, please. So just to start off, I'll tell you a little bit about New Jersey Transit. New Jersey Transit is the nation's largest statewide public transportation system, with providing more than 900,000 daily trips. Obviously, this is pre-COVID times. Currently, right now, we are on the road to recovery, slowly increasing our ridership. For more information about Transit's efforts on the road to recovery, feel free to visit our website at www.newjerseystransit.com/recovery. New Jersey Transit operates on 4 modes. And as I said, we are the nation's largest because we operate the statewide system, unlike other states around the country. We have 251 bus routes with 18,000 bus stops. We have 3 light rail lines with 62 light rail stations, 12 commuter rail lines with 165 rail stations. We also operate Access Link, which is the state's paratransit service that shadows our local bus route system. And the department that I work in, which is where we pass through federal and state funds to state agencies, counties, municipalities, and nonprofits throughout the state of New Jersey. Next slide, please. New Jersey Transit has a lot of senior-friendly features throughout all of our modes. One is our multiple information channels. We provide information in a lot of different formats, obviously all accessible to people with disabilities and seniors. You can access our information via print on our schedules at any stations. You can also access how to book a trip or just map your destination on our website. We have mobile applications. We do group presentations at different locations around the state that describe our accessible services. And as Karen mentioned, we also sponsor some travel training through 2 grants that we administer through New Jersey Transit. We also have the Reduced Fare Program, which provides 50% discount on fixed route buses, rail and light rail. We also have a new feature, which we are providing reduced fare cards with anybody that is approved for Access Link service, which is great. Reduces the verification of your disability. We have bus stop amenities like benches and shelters. We have the ADA paratransit service, which is for qualifying individuals with disabilities. Although it's not directly related to seniors, any senior that has a disability that prevents them from using the local fixed route bus can apply for Access Link service. And we have grants that we provide to counties, municipalities, nonprofits that serve people with disabilities and older adults throughout New Jersey. Right now, we have over 100 subrecipients that have that funding source from New Jersey Transit. Next slide, please. So my department, local programs, minibus support, and community mobility. We administer approximately $45 million annually in state and federal funds through the Federal Transit Administration. And these funding sources are passed through New Jersey Transit. So we are the administrators of the funding sources. We have the Casino Revenue Funding Program, which is a state funding source that comes through the casinos. 8.5% of their revenue is geared towards services for seniors and people with disabilities, and we get about 8.5% of that pot. We have the Section 5310 program, which is a federal funding source for enhanced mobility for seniors and people with disabilities. We have the Section 5311, which is designated to the rural areas in the state. And we have Congestion Mitigation Air Quality, the CMAQ funding, which is a federal highway program, which is flexed to New Jersey Transit to get people and cars off the road and really provide some more coordination with mobility. And we have the NJ-JARC program, which is a job access and reverse commute, which provides a lot of transportation and routes and deviated fixed routes for employment in industrial areas. All of our programs are designed to meet the needs of senior citizens, people with disabilities, rural residents, the economically disadvantaged residents, and it also includes general public in a lot of cases. Most of our funding sources can be used for operating, administration, and capital expenses. And as I mentioned previously, we have over 100 subrecipients throughout the state of New Jersey that operate services through our funding sources. Next slide, please. New Jersey Transit and our department, Community Transportation, we have a lot of initiatives going on in the state right now. You know, we obviously are on the road to recovery on the large transit scale. As I said, please feel free to visit our website. It has a lot of good information on it that can really you can see what initiatives are happening at the transit level to really get our services back up and running to full capacity. That website is www.newjerseytransit.com/recovery. We also have we received some funding from the Federal Transit Administration to create some accessible services videos to really help seniors and people with disabilities know what is available on New Jersey Transit to help you with your commute and with booking your trip. It goes into some detail about how to operate our lifts and all of our other accessible features. Unfortunately, right now, due to COVID, we've kind of been at a standstill, but we are slowly but surely starting that effort up again to finish recording those videos so that they can be released to the public via different mechanisms such as our website or YouTube. So it's a very interesting venture. We also sponsor travel training through 2 funding sources. One is through the Casino Revenue Program. Those funds are used for individuals that are using Access Link or are in the process of applying for Access Link to really give them a experience and some lessons on how to use a local fixed route bus. We partner with NJ-TIP at Rutgers for both of our funding sources. And through the Section 5310 program, we sponsor group training, which has been very positive and has really helped a lot of individuals learn how to use public transportation. One of our very exciting new ventures is we are testing autonomous vehicles in New Jersey. We are partnering with Rutgers Cates with a tech company called Infotech and Fort Monmouth Revitalization Authority to test low-speed autonomous vehicles in New Jersey. We really want to see how these vehicles will operate in an environment like New Jersey, considering, you know, we have all 4 seasons here, from snow till, you know, summer. We also have a lot of different types of terrain. You know, we have urban areas, rural areas, suburban areas. So we want to test these vehicles in New Jersey to see what information we can access from these testing. Our first stage will be testing on a closed course setting in Fort Monmouth. They are partnering with us and lending us their facility to really be able to do some close course testing, and also to bring other people in, users, advisory committees, so that we can get some feedback and some survey done on how people feel about these autonomous vehicles before we can even think about operating them in New Jersey. We also have, currently we have quarterly meetings through the New Jersey Council on Access and Mobility. It is a informal group of state agencies and local transportation agencies where we get together every 3 months to discuss transportation issues and how we can work together to provide better access to our seniors, people with disabilities, and you know, residents in rural areas or low-income residents in New Jersey. We've been fortunate that the state has seen the importance of this group and has now been working towards making it an official committee again through legislation. So we plan to see some movement with that in the near future, and we will keep everybody posted. Another interesting initiative that has been going on for quite some time is every county has a coordinated human service transportation plan where it outlines the needs and gaps in each county. And those plans are used to identify future potential projects that are established or that are applied for through our federal and state funding sources. Those plans can be accessed through most of the county websites. You can put in the search engine Coordinated Human Service Transportation Plan and really see what is currently going on in that county, what services are available, and what needs and gaps they've identified by surveying the public. Last on my list for initiatives going on in the state is our TNC pilot program. If everybody's aware, TNC is transit networking companies such as Uber and Lyft. In 2019, New Jersey Transit put out a pilot program to encourage partnerships with our county providers to partner with TNC companies to try to meet some needs and gaps that we were seeing throughout the counties, such as evening trips or out-of-county service, or really just any trip that the counties weren't able to accommodate into their schedule. Right now we have a pilot program which has been very positive and has really made a dent in the county service, which is for Essex County. And lucky for us, we have Michael Vieira here with us. And I just want to take out a couple of minutes to give him the opportunity to just give us a little insight on his program and how he's currently doing and what type of impact it made on his services. Mike?
Oh, thank you, Janelle, and thank you, Karen, and welcome everyone. My name is Michael Vieira. I'm the Director of Transportation for the County of Essex, and let's talk pre-COVID in regards to the TNC. Although the TNC program really has helped Essex County transportation during this COVID pandemic, but let's talk previously before COVID. We started our TNC program through Ride for Life back in April in 2019. And from there, we started the first month with maybe doing 54 trips. By the time January rolled around, we were close to 1,000 trips a month in regards to the TNC program. What impact did it have on Essex? Well, for most of the county systems, we have some time periods where it's very difficult to arrange for medical appointments, such as between the hours of 7:30 in the morning to 9 o'clock in the morning. That's because many of us are having a lot of our vehicles do shelter workshops. The same goes for the fact of taking the shelter workshops back home between the hours of 3 o'clock to 5 o'clock. So those times I couldn't schedule any doctor's appointments. Also, in regards to that, between 11 o'clock and 1 o'clock, we had our nutrition transportation. Couldn't hardly schedule any medical appointments there. So the TNC helped greatly, allowing us to schedule doctor's appointments with people who were comfortable with this TNC program. If they weren't comfortable, at least we were able to free up a vehicle, especially for our wheelchair clients. So we never denied a trip regarding doctor's appointments when it came to either giving them a TNC trip or having them need a ride, but it be in a wheelchair. So we did make sure that we made sure that all of our wheelchair clients were also accommodated. Also, we had some Saturday trips that we could not do only because of funding shortages. With the TNC, we were able to add a couple of extra trips on Saturdays and Sundays, thus saving money too, because most of the counties, including Essex, an average trip is about $26 a ride. For us, the TNC program was about $16 to $18 an average ride. So definitely a cost savings there. Now, in regards to the COVID issue, TNC really has saved Essex County. What we ended up doing was, and we're still doing it, is we're providing one-on-one transportation now, meaning that we are not putting multiple people on our vehicles. Just in the event that one person is sick, we do not want them to get other people on the vehicle sick. So, we have a fleet of 40 vehicles. We're not going to do all of our transportation needs with 40 vehicles. So at that point, that's where the TNC program really kicked in, where we were able to send out Ubers and Lyfts to many of our passengers who felt comfortable taking the Uber and Lyft. And once they took the transportation, they actually now are requesting the transportation. It's almost like a one-on-one transportation, a private service. You have the ride in the control of your hands. Whereas if I was to provide you a ride with the Essex system, I'm telling you, be ready 1 hour before your appointment, and we have a window of 1 hour to pick you up and deliver you to your appointment. Whereas the TNC program, we give you a phone number to call. The ride is in your hand. As long as you know that it's going to take me 20 minutes to get to my destination, I'll add another 5 minutes for the Uber or Lyft car to get here. You know what time to call, and you know what time that vehicle will get to you, and you know what time you should get to your doctor's. You're not going to have to wait an hour to be picked up and an hour to be taken home. So really, we look forward to continuing the TNC program in Essex County. It really has been a change.
Michael, thank you so much for giving us that recap, and Janelle for arranging for Michael to be with us. I think it's really helpful for people to get a sense of some of these efforts that if they may not be in that county, they may not be aware of them. And I think
yes, thank you, Michael.
Yes. I think that's a great transition for John to talk about the program he's been running in Morris County. Next slide.
Morning,
please.
everybody. Good morning. Thanks, Janelle. Thanks, Karen. Thanks, Michael. I am the president of Tri-Town 55 Plus Incorporated. You have our contact number there. We came together in January 2016 because we wanted to assess the needs of our older adults in the towns of Chatham Borough, Chatham Township, and Madison. We chose these three towns because, number one, we are adjacent to one another, and number two, we have merged services. The courtrooms, construction, at that time it was the health departments. The two Chathams have merged school systems, so we thought it was a comfortable fit. The first thing we did was partner with the University of Montclair to run a survey to find out exactly what our needs, the needs of our older adults were. And we started that in March. And I will be glad to send to anyone the questions if you want to get started on something like this. I will be glad to send you the questions we used and all of the results that we obtained. We also held, besides the survey, we held public forums, 4 different public forums around the 3 towns. And basically the top 3 priorities of our older adults were housing, transportation, and information. So in April 2017, we began our transportation project, was called Rides for Seniors program. We partnered with a company in California, appropriately called GoGo Grandparent Incorporated, and you have their contact information, basically for the residents of our 3 towns. And what our residents were looking for, because many residents over the age of 65 and 70 do not have smartphones. And like Michael had said, we're using Uber and Lyft rides. You basically would call GoGo Grandparent at their 800 number. And the phone is basically automatic. They know where you live when you register. It's free to register. And basically it's 24/7 service. One of the things we noticed in the variety of transportation methods in our state and county and local senior centers is that there's operations at certain times during the day. Many of the services don't operate on weekends. This operates 24/7. As an example, one of our riders' son had to go to the emergency room at 2 o'clock in the morning, and she had no ride. She didn't drive, and she had a ride within 10 minutes. So this is the type of thing we offer. So far, we have 454 registered riders, and to date, we've given over 5,000 rides. Our older seniors love it. Right now, we offer a $5 discount for each rider for 4 rides per month. Next slide. So in December, we did an audit of where these people were going. Our goal in this whole thing was to get older seniors who don't have smartphones, get them out and about and socializing. And as you can see, 28% were for medical trips. The problem we have, one issue we had with the county was pre-pandemic, was that you had to make appointments through their bus program 2 weeks in advance. This is entirely generated by the rider themselves. They call the number, they control the entire operation. And one good point of registering with GoGo Grandparent is that the rider can put their caregiver on the registration, and whenever this rider is picked up and dropped off, that caregiver will be given a text message. So from this pie chart, you can see that 28% was medical, and the rest was basically socializing, whether you went to other social venues like the Y, other gyms, whether you did shopping, whether you visited other people, whether you went to restaurants. And many people and 8% were using it as transit links, meaning they took the service to go to a local train station. Many of them took the ride used it to go to Newark Airport for further travel. So you can see 53% of the rides were for some sort of social purpose. Next slide. Okay, the age of our riders, as you can see, predominantly 87% of our riders are over 70 years old. We limited the ridership to people 65 and older, but we found that many of the people 65 to 70 and many people in the 70 to 74 age group and above, many do have smartphones and therefore can access Uber and Lyft directly. But 87% of our riders are 70 or over, 72% are over 75 years old.
Interesting.
So we think our program has been quite successful in the goals that we wanted for it. Next slide. Okay, pre-pandemic, we were averaging approximately 110 to 120 rides per month. Since the shutdown in March, it obviously went down to 0. However, in April, things started to creep up. People started getting out again. And in August, we had 143 rides, which is above our average monthly pre-pandemic. And I think one reason for that is our local senior center bus services were shut down. They are still shut down. And I know for the Chatham Senior Center, they don't plan on having a bus service anymore. So we're working with them to incorporate our rides program into all of their programs. Next slide. Okay, we can go back to the moderator. If there are any questions, we'd be happy to answer them.
Actually, thanks very much, John, for that presentation. And I do want to open it up for questions and discussion from the folks who've been listening so patiently while we've been together. I want to jump ahead one quick slide and then jump back, Shannon, if you could help me with that. So just so you should know, I mentioned it in chat, but the information about the senior survey for the older senior mobility study, this information is here on the slide, but it is also in the resources tab for the conference as a flyer. And you can download the flyer, share it with other people, and the link in the flyer is active to go directly to the survey. So I wanted for folks to know that that's available. And by all means, please feel free to disseminate it through the end of the week. We're still very much accepting input. You could take us back to Q&A. I'd like to open it up for anybody who's got a question. And I guess we're going to use chat. Is that, or let's try unmuting people. And if it gets too much bedlam, we'll go back to muting everybody. Okay? Let's see if we can manage this as a small group. And Shannon, I don't think we need your screen. I think we can go ahead and
we
go
can
to
stop sharing it.
gallery. Yeah.
Right now. Okay.
And if folks can turn on their cameras so we can see you, if you've got a question, just raise your hand and we'll open it up. Don't everybody jump. Edward.
Hi. I just wanted to kind of follow up on the Tri-Town presentation. I'm in the South Orange Maplewood group. We've used some elements of this, and we've also found it to be popular for the reasons that John mentioned. You control it. You can get them 24/7. Dealing with the county is dealing with the county, and you sometimes can't get what you want, or many of their services are only in county. So if you live in Essex and your doctor's in Union, which is 3 miles away, they won't take you there. So I think that's very good. I think people who had driven for 40 or 50 years, this is an easy transition than waiting, get an hour time frame and all the other things. So that's good. As far as within the communities, as John mentioned, and the same thing in our area, all of the buses that were running typically through the health department or recreation departments are shut down because of the COVID problem. The other issue back in normal times, I think we had trouble getting people to transition to public transportation. And so that has to be looked at. Another item that under mobility, to me, when I signed up for this, I'm looking at technology as a form of mobility, and that's something we need to talk about. And one last thing, mobility also means walking. You can walk and get places. So issues of pedestrian safety are key in our community. We've had a lot of issues with that, and there's a lot of concern about it because, again, that's a good way to get out and exercise and all the other things, and also, walk to the supermarket if you live in the right area.
Edward, I think you make some really good points, and I'm just curious, in terms of technology, among the folks who are in the conversation, what changes have you seen in terms of technology use with the older adults that you're working with in the last 6 months?
I'll just say quickly, people have adapted to Zoom like
Right.
that. Yeah, I mean,
So I
don't
think
you hear my,
so that's
So
one. What other
that's-
changes have folks?
and that sort of is a
Observed.
doorway to get them into maybe email and other things too.
Okay, so
Shut up.
Zoom. Other observations, Jackie? Unmute yourself, Jackie.
Sorry. Yes, definitely. I was surprised about the facility with Zoom and the fact that people feel like they've actually sort of been with people after
Mhm.
they've been on Zoom. So it's uplifting and in ways that I didn't expect. However, we have a priority concern about people who wouldn't even have access to the internet. There are many isolated older adults who need transportation, who would have gotten transportation to go to the senior center for lunch for their hot meal. They're now getting Meals on Wheels.
Right, they're
Many-
bringing them to them.
Right, bringing them
Right.
to them, but that's a problem. And we are going to be working with the Teaneck Public Library. This is age-friendly Teaneck. I did not
Thank you, Jackie.
identify myself. I was the coordinator. Now I'm the project advisor. We are working with the library, with the township's blessing, to develop a series of trainings for older adults. Now, of course, if they're not comfortable or they don't have the devices, you can't teach them the devices using devices. So we are going to be using Teaneck's cable access channel.
Excellent.
Practically everyone has a television and the either cable or Fios to be able to see that. We're going to be doing a series, but we're going to start with Zoom or ways to use cell phone. We're hoping to get some funding that may enable people to get iPads. It's not the iPads as much as the internet access. When we don't want to give something that we have to take away if we can't sustain the cost. But I think that this is, I'm really excited about this. I think there's the possibility of bringing in a lot of people who might never have thought about using technology that way.
Other thoughts about what people have seen change? Jackie, I appreciate your suggestion. And, as I said, running NJ Tip, I've always said, if you can't get there, it doesn't exist for you. And I've had to invert that in terms of if it can't get to you, right? Or if you can't connect to it, that's the problem. It's not just necessarily the physical mobility is the only way to connect people to what they need and what's going to sustain them. Brad, you had your hand up or something you'd like to add. Please unmute yourself.
Hear me now?
Yes.
Okay. Good morning, everyone. My name is Brad Shinani. I'm from Lifelong Westfield.
Welcome.
Thank you. We have had weekly Zoom conversations on Friday afternoons, and it's worked out very, very well. The only unfortunate thing is Zoom only reaches about 35% of our seniors we found through our survey in town. So it has worked out well. We have a portion of our clientele that like to be reached by phone, that like to be reached by mail service. So it does become a little difficult. We wish that we were 20-something and could reach 99% by email or by Zoom, but unfortunately that doesn't always work for us. But the 35% that can be reached by the internet by Zoom, it has worked very, very well. One question I have is, because we are also closed down as far as our town transportation system, is that because with New Jersey Transit being part of the Raton Valley line, we don't have one-stop service into New York City for those seniors that want to go into the city. So I think a group, that Tri-Town group that you talk about for transportation, could be something that could be very, very relevant for us.
If I can interject, the
Please.
GoGo Grandparent is nationwide and in Canada. So, and it essentially, it can run itself once the person registers.
Mm-hmm.
Runs itself because the person controls it. How we work it is the person provides a credit card, and GoGo Grandparent has our credit card. So whenever they take a ride, they get, our credit card gets debited $5, and then they get debited for the remainder. And it's easy to run, like I said, and it runs by itself. Even if we disappeared tomorrow, they could still get rides.
I have suggested that to numerous seniors in town, and I'm hoping that as the pandemic, which who knows how long that'll be, but that becomes more prevalent for our seniors also. Thank you.
I just added to the chat, and I wanted folks to be aware that Senior Planet has put together a really nice resource on how to use Zoom. They're an organization that's been teaching seniors about technology for decades. And within that website, there's actually a link to a PDF that you could print off and share with people. We did that at my synagogue this year so that folks who were older and wanted to join us for Zoom services had a hard copy of something they could follow along with to set themselves up to be able to use Zoom.
That's
So
great.
the link is there in chat. You can grab it if it's helpful.
Thank you. Thank you. Senior Planet is spectacular. I've been doing a lot of reading about their senior playgrounds, which are starting to pop up around the country also, which I think is wonderful.
Michael, I saw your hand up. Comment?
Yeah, I think, I think we've always had a preconceived notion that a senior citizen was not tech savvy. They didn't know computers. They didn't know smartphones. That's why they always had a flip phone. If you want to take this pandemic and say, hey, something good may have come out of this pandemic, I think one of those is that a lot of senior citizens now have become tech savvy. Such as, I see Liliana Bronchino on the line from Livingston. Who would have thought 50 senior citizens over the age of 80 would know how to use Zoom perfectly? And every Tuesday, there's a group that meets, and they're meeting right now, actually, that they're perfect at it. But you know what? They probably never even gave themselves a chance to use it. I know a lot of children had gone out and bought their parents smartphones and iPads so they can communicate during this pandemic. So you know what? If there's a good thing that came out of the pandemic, it may be that senior citizens have become more tech savvy. And I seem to be finding.
Liliana, there's something you'd like to add to that? Thank you, Michael.
So thank you, Michael. So Michael and I are able to work together, and his office has been of great help to us too. During the pandemic with our seniors, we were able to use Ride or Ride for Life as another alternative to GoGo Grandparent. So GoGo Grandparent, when they started, I recall they were only up to 8 o'clock at night. They weren't really, now I guess they've extended
They've expanded.
pandemic or what it was. But what we are doing, and yes, just as a side note on the technology, we also conducted a survey, and it's amazing how seniors have adapted to technology and interest in Zoom. I've run daily fitness classes for seniors, and it's been a life support during this pandemic. It's a way for us to meet, and we talk before class, check in on everybody.
Right.
right now also what's surfacing is we're starting to get sponsors. Sponsors are reaching out to us wanting to sponsor different programs. And I just put together a 6-week program on technology with a sponsor. I have a computer training service company that I've worked with in the past. And now, obviously, to Jackie's point is people have to get on Zoom in order to learn Zoom, which kind of is a little, and I like that idea of posting it on the local channel, the TV channel. So I think that's my next step. But also we try to utilize the local newspapers as well. You know, we send out the information and do press releases and so forth. But the fact that sponsors are starting to surface, technology, I mean, again, yes, like Michael said, I have people over 80 and 90 on chair yoga class. I have 35 people in the class. And this is 3 times a week. So it's really impressive. But I've had to take in a lot of time and go one by one with them and walk them through the steps on how getting to Zoom. So in any case, yeah, I'm trying to take some advantage of some of the sponsors that are trying to, so that we can offer these options. And again, Ride for Life and Easy Ride have been really a key also. Our transportation has already started, our senior transportation.
So
Started already. Yeah, we started it last month. And it's only maybe 1 or 2 people can ride the bus.
So I think there's a couple of points that I've heard that I want to reflect on, and Melissa has asked a question that I want to put out to the group. The first is we get very focused on Zoom and the technology, and the reality is conference calls can work just fine, and some folks are more comfortable, and Zoom can also be used in that modality. And so it's the bright, shiny object, but we need to remember that underneath it, you can actually use it by phone. You don't get the video, but you can get the audio. So I think that's one piece to sort of think about. Melissa asks, and I want to put it out to the group, has anyone found a way to address the issue of affordability and access? Not just the interest in terms of being tech savvy, but seniors who don't have the internet because of financial issues. Suggestions from the group? Anyone got an answer for that? Other than Lifeline service, which is, you know, the basic internet that's available for low income folks.
Yeah, Karen, I just want to elaborate on that a little bit, is that, you know, I'm asking it, one, because it's an issue that I've thought of myself, but I'm also getting emails from people asking, do I know of a resource to help people get access to an internet service? And then more prevalent than that is seniors who are interested in learning Zoom or interested in getting more interactive with technology, but can't afford a tablet or you know, or a smartphone, and how do we get them assistance with getting those things? I know there has been some funding that's come down to the county offices on aging, but it's not clear yet how they're all going to roll it out in their county in terms of it. And a lot of it might just be technical assistance and not devices, not, you know, support to buy devices.
So one of the things I'm aware of, Melissa, that I just want to share from other parts of work that I do is the New Jersey Council for Developmental Disabilities put out a grant offering early in the pandemic that connected something like 600 people with disabilities with technology, with tablets or smartphones that they could use for connectivity. And they had a relatively simple grant process where you explained, this is what I need, this is why I need it. And they did a lot of giving people tablets that were $80, $100 tablets. And they prioritized folks who were in group settings or group homes where that tablet could be linked to a TV and then give, you know, participation to more than just that one person. And I don't know if something similar might be advocated for in terms of within the aging network within New Jersey. The ARC of New Jersey managed the grant process. NJ Council of Developmental Disabilities provided the funding to then pass it through. But I think that really spurred a lot of development programmatically, because now there was an audience that could actually use this stuff.
Yeah,
so
that's
just
helpful.
one suggestion from within New Jersey.
Appreciate it. It's good to know.
No problem. That's why we're here.
Karen, can I
Anybody who hasn't spoken yet that would like to speak?
Can I just say something to Melissa?
No,
thank
go
you.
ahead.
You know, I may not have the answer, Melissa, but you know what? I know in Livingston, we have Kiwanis clubs and Rotary clubs
Yeah.
And I know that I'm part of both of them. And I know that they put money aside when the pandemic was difficult in the hospitals, and they purchased $100 iPads so patients that are in the hospital can talk to their loved ones. You know, that's something that you can go to too. They do have money aside, and you know what, and see whether they'll donate some iPads to some needy seniors.
Yeah, no, that's another great suggestion. I appreciate it, Michael.
So I'm going to ask for a last round of questions or comments. And I want to give my co-presenters an opportunity to say anything that they'd like to in terms of closing. John, any final thoughts?
Again, I'd be glad to talk to anybody in this group if they wanted to set up a rides program similar to ours.
Yeah.
You have my information. I'll be glad to talk to anybody. One thing as far as training older adults on Zoom, one of the Senior Center of the Chathams, you know, I'm a trustee there, but we bring in the high school key club. We bring in the teenagers to teach as part of our intergenerational activity and teach them how to use all these new devices that their kids bought them. And now we do it outdoors. So, but we're going to go back indoors in a couple of weeks. So.
Okay. John, thank you. And thank you for giving us a nice deep dive into your program. Michael, also thank you for giving us some insight about what's been going on in Essex County and stories from the field on that front. Janelle, any final thoughts?
Well, just want to thank everybody for joining us on this very important issue. We know that transportation seems to be always one of the major barriers with accessing any form of program for both seniors and people with disabilities. My contact information is also available. Please feel free to contact me if you have any questions regarding any of our grant programs. And, you know, also I know somebody addressed in the chat earlier regarding the autonomous vehicle testing. Yes, we are in the very beginning stages of the pilot program. But if you're interested on involvement, I'm leading the community outreach portion of it. So feel free to send me an email with your contact information. And once again, thank you for joining us.
Terrific. And I want to
thank you for having me.
I want to thank everybody for your questions, your thoughts, the rich chat. And I just want to encourage folks, get out there, walk, be safe, wash your hands, wear a mask. But, you know, as long as it's beautiful out, let's take advantage of it. NJTIP will continue to be teaching people how to make essential trips. And we're happy to talk with any of you about doing virtual or remote field trips, if that's something that's more appropriate or you're more comfortable with right now for your clients. So with that, I'm going to say thank you, Shannon. You've done a wonderful job being our support and our AV. Rini, thank you for inviting all of us to be here. And I think, have a great day, everybody. Bye-bye.
Bye.
Bye-bye. Stay safe.
Bye, Rini.
Thank you, everyone.
Thank you.
There she is.